Hello and welcome to this special chat with Fiona Patten on the proposal to decriminalise drugs in Victoria. My name is Nick Wallis. I work with Harm Reduction Victoria, and I'm also a member of the Yarra Drug and Health Forum Executive. I'd first like to acknowledge that I am meeting on the lands of this Zoom meeting on the lands of the Wurundjeri people of the Kulin Nation, and would like to pay my respect to elders past and present and anyone who might be tuned in to this broadcast. I would like to introduce our guests this afternoon. Our two guests, our host, Peter Wearne, the chair of the Yarra Drug and Health Forum, and of course our guest speaker, Fiona Patten, member of the Legislative Council, founder and leader of the Reason Party, and she represents the Northern Metropolitan Region. Welcome.
Thank you, Nick.
Thank you, Nick. So, Fiona, really appreciate this brief interview that we're going to do with you about the legislation. The first question that we have is why now and why this legislation?
You're right. Why didn't we do this 30 years ago? Mm-hmm. Why are we in 2022 and we are still jailing people for using drugs? It is insane. And, why after nigh on 70 years or 60 years, we're still saying that we can arrest our way out of drug use in our society. It's never worked. It doesn't work now. And what is clear is we need to change. So I apologise for taking this long to get to this point. I wished I had been able to get to at least this debate in 2014, when we did the drug law reform inquiry in 2017, where we showed members of parliament what a different approach to drug use could look like in places like Portugal, places like Switzerland. Now is the time. We arrested 26,000 people for the use of drugs or the possession of a small quantity. 26,000 people. It is the third highest offence that goes before the magistrates' court. It takes up about 15% of the magistrates' court's time. And imagine how many hours police are taking producing briefs, attending court, even if it did go to a diversion or a community correction order or a no conviction recorded. We've got police spending thousands of hours on dealing with a health issue as a criminal one. So now's the time to change and treat drug use as, for what it is, a health issue.
So the other question is, given the logic of what you've said, and it'll be no surprise to those people listening or viewing this recording that the Yarra Drug and Health Forum has always been about sensible legislative law reform in the area of drug policy. You must have had conversations with people that disagree with you. What are their objections to not doing this now? Where is the main opposition coming from in terms of logic and argument?
To be honest, and with great respect to many of the people I've spoken to who may disagree with this, there's not a lot of logic in the argument that we need to keep doing what we're doing. And when you say, but it's not working, when you point out that 30% of Australians have used illicit drugs, probably more, that these laws did not stop people from using drugs. And by decriminalisation, their fear that more people will use drugs is unfounded. There is no evidence to suggest that if you treat drug use as a health issue, and we're not saying that this is being soft on crime or anything like this. We're actually, for some people, it would probably be easier to go to court and get a no conviction recorded than actually having to maybe address their drug use. And so for most of the arguments about this is a fear that it will increase drug use, that more people will use drugs. And I just have to say to those people that the evidence doesn't bear that out. I was just actually looking at some figures this afternoon, comparing Portugal with the United Kingdom. because the EMCDDA keeps data on both of those. Now, about 11% of Portuguese people, Portuguese adults, have used substances in the last 12 months, compared to 30% of people in the UK. So Portugal shows us that you need not worry about the increase in drug use. Does this give a free kick to traffickers and manufacturers? No, it doesn't. And in many ways, it will actually free up police time and resources to deal with that end of the market. Now, look, whether we agree with decriminalisation or legalisation, I think that's another conversation for another day. But right now, to me, this is a very modest step that is just effectively streamlining some of the processes we already have to ensure people that need it get the intervention. And it might be an early intervention. It might be a young person who's couch surfing, who's really seriously, their life is spiraling for a range of reasons. And this might just be that early intervention that captures that and can change the trajectory of that person's life. Or it might be someone who has been using heroin for decades, has been in and out of the justice system, and all that has done is made their life harder, where this may provide them a pathway to recovery, or a pathway to a life that, is easier, where you can get the help you need, where you can get the work you need, where you can get the housing that you need.
So being probing that a little bit more, you mentioned the word legalisation versus decriminalisation. There would be many people in the libertarian drug law reform world that would say this is being a bit half pregnant. Why not go the whole way and legalise, regulate and normalise supply rather than having a pseudo reform? So they're not my words,
no.
but that's one of the arguments. So it seems that there's people who are very much aligned with your thinking, and they're saying, well, hold on, we're still involving people with the police. They're still technically they're still breaking the law. If you refuse treatment or education sessions, you still go to court. You're still being wrapped up in the justice system. So I suppose the devil in the detail about, is this really going to separate people from the justice system, or is it replacing steel handcuffs with golden handcuffs?
I don't think it's doing that. I do think that this is definitely a step in the right direction and a step forward. Now, you'll probably get no argument from me if you said the best way to ensure people are safe and that we can prevent accidental deaths from drugs would be to regulate the market, and would be to control the market, would be to control the supply, the manufacture, the rest of it. However, and I don't think there's a day that has gone past since I was elected where I have not uttered this or thought this: do not let the perfect get in the way of the good. And if we can make a small step, and if we can bring most people along with us to say, we're not legalising, we're not suggesting that all drugs should be available. What we're suggesting is that we need to take a different approach. You're absolutely right. This does not necessarily keep people out of the justice system inevitably. But what it does at the beginning, and it does ensure that the first port of call, the first option that they have is a health option, and it's not a criminal one. So it is putting that first and foremost. It is providing a triage system at that intervention, at that moment, to divert people away from the justice system. You're right. It may not actually keep everyone out of the justice system, but I reckon when we're looking at 26,000 people every year, 72 people a day in Victoria are arrested for the use or possession of drugs. when you look at those sorts of numbers, this has got to provide some benefit. This has got to be an improvement on what we're doing. No, it probably is not perfect, and I will be the first to acknowledge that. But what I do acknowledge is what I do hope, and what I hope that we can get through, is something that is better than what we're doing now.
Fiona, I was wondering if I could just jump in quickly here, because during your 2 terms in Parliament, you've also been the chair of a few inquiries that have related to drug law reform. There was a wide-ranging one with a 650-page document that was produced, and I think that was 2017, 2018, and that was the inquiry into drug law reform. I'm just wondering, how does this sort of reflect some of the recommendations that came out of that document? I've got on screen here recommendation 13, which relates to the personal use and possession, and people can have a read there of some of the recommendations that were in there. And I'm just wondering if you want to reflect on that inquiry process, and whether that's we are now stepping towards implementing these recommendations. Well, this is in a perfect world if the bill were to pass, but let's assume that.
Thanks, Nick. And I do reflect on that. And in fact, recommendation 13, it was so interesting, and I don't think I'm speaking out of school now, that what people, I think everyone around the table agreed, and particularly those that have been overseas, particularly those that have been to Portugal or had been to Europe and had seen drug use being treated differently. They all understood the idea of decriminalisation. They hated the word. They hated the notion that you would decriminalise drugs, that somehow that was giving people permission. So in that very carefully crafted recommendation 13, we tried to talk about decriminalisation without talking about decriminalisation. We tried to talk about a streamlining of diversion, a depenalisation of drug use, as it were, something like that. And yes, this bill largely reflects that recommendation. And it reflects the kind of the modest nature of it as well. This is a modest change, and I think that's why we have so much support for it. That's why you've got, I wouldn't say radical organisations like the Royal College of Australian General Practitioners, the Australian Lawyers Alliance. Those types of organisations, these are not radical organisations, and yet they are fully supportive of this policy approach.
I'll jump in there. Is there any sense in which there's an unintended consequence of this legislation? Because one of the things that has occurred to me is that, let's say that I'm a 64-year-old, middle-aged, older white person, male, which could be me, and I'm found to be using some illicit substance unproblematically and for many, many years, and some 25-year-old policeman is referring me to a drug education program at a treatment service. I'd be just clogging up their foyer, and so one of the things that needs to be thought about or asked is, how are we going to resource? If those 26,000 people end up in drug education and drug treatment, there's already a 9-month waiting list for residential beds, and there's already a 3-month waiting list for many counselling services in the public drug and alcohol, where it is overwhelmed with demand. And I think many of those people probably don't need to be in that system. So it goes to the drug literacy of the community, but it also goes to the infrastructure of what we provide. This is going to cost a lot of money. I mean, mind you, it costs $150,000 a year to put someone in prison. So maybe there's a saving there.
Yeah.
So how do you respond to that?
And you're absolutely right, Peter. And I think these are really important issues to grapple with. Like, yes, are we going to see a net widening? Are we going to see circumstances where the police may have just, told someone to piss off and go home, and put that joint out? Are we going to see those people being issued with an infringement? The evidence we saw from Portugal is not that. But your far more important point around the services. So in your hypothetical in your hypothetical with the 64-year-old white man who has been caught using a substance that he's used for many years unproblematically, the way we would see this is similar to Portugal, but in a more streamlined way. That this would be a triage approach. So the first protocol is a call, and there would be a series of simple questions there, because you're actually trying to pick people up who are in trouble and need help, and you're actually wanting to direct them to it. Yes, we're going to have to reinvest in our services, but I don't think that anyone disagrees with the fact that we need to invest heavily in our alcohol and other drug services. From the Royal Commission into Mental Health to the police's own drug strategy, all of them are calling for greater investment in AOD, and we know that will actually have long-term savings. We know that it will save money eventually. But in this system, we would see that this would be a triage system. We would see that some people's education pathway may be something similar to the cannabis cautioning, which is an online education program. But and in saying that, I also reflect back on the drug education that happens at pill testing events. And you look at that education, like all of a sudden, a person who is using drugs is getting honest, scientific information about their drug use. And it's remarkable. Like I couldn't get over how many questions people were asking when they were in that circumstance. These were people who weren't problematic drug users. They would use at festivals or occasionally on weekends. But there are questions about, did this substance interact with them, with prescribed substances? How did this substance, what happened if they mixed it with alcohol? What happened with this? And, there's some really great resources out there that look to this, but this may provide some really terrific avenues for people to actually ask those questions that they've never been able to ask anyone before. And I think that would be an absolute positive. I think on the other side of that, when we speak to doctors say because of the criminal nature of use and possession, that their patients struggle to talk to them honestly about their drug use. And that's the stigma that is connected to that. It's more connected to the stigma and not being able to discuss that with their doctor. So the doctor might be prescribing them a medication that might go very, very badly with MDMA or with another substance, but the patient doesn't ask and the doctor doesn't say. And I hope that this type of reform, as you're saying, in that community literacy around drugs, that this actually enables far better health conversations, possibly even earlier as well, when someone may be having problematic use. I think conversations around problematic alcohol use are probably happening, more and more, and I hope that they're happening at earlier points in people's lives. And so the other long answer to this was that if this happens, then what I hope we would also see is a reduction in the need for acute services, because we would, and acute are our most expensive services. Yep. So if we can actually bring people back and we can be providing them with assistance at an earlier stage in their journey, then we would probably find another savings.
I think a lot of the as with all of these things, a lot of the sort of the difficulty is in the details, and reading through the bill itself, I guess there's questions around who has the power to decide things, especially when there's words like reasonable grounds and when that power is held by the police. Maybe you could comment a little bit about what your thoughts are on whether or not the police could be vetoing certain orders under the proposed bill, and what where these lines are drawn, how the lines are drawn on who's accessing what, and whether or not they are accessing treatment or they're receiving a different kind of penalty.
Yeah. I think it's a very good point, and in fact it's actually one of the objectives of this bill. So the main objective on this bill is that everyone is treated equally. At the moment, we rely on police discretion. Yes. This actually takes that discretion out of the conversation and out of the procedure. So everyone is treated equally. We know, looking at, and Dr. Kate Sear has done some great work on this. We know that some cohorts of people do not get diversion. They do not get cautioned. A 64-year-old white man who is comfortably employed and living comfortably will, in all likelihood, be treated very differently to a 21-year-old Aboriginal young man who is couch surfing and who probably needed the help far more than the comfortably employed older gentleman. So yes, this is about taking that discretion out. It's not enabling police to veto. But certainly, if the drug use is part of another crime, such as family violence or assault or anything else, then that's null and void. The other crimes the person is arrested and charged with those crimes. So I think in many ways, and this is about trying to convince the government to try something different. I think the police want to try something different. This is about getting the government to. And if I could just put a plug in, we're trying to send emails to our members of parliament. We've got a website, which I'm sure Nick will put down the bottom, decrim.com.au. It provides a very easy pathway for you to send a message to your local member around the decriminalisation of the use and possession of drugs, and to put your support behind that, behind this campaign. The bill will be debated on Wednesday the 9th. So we've got till then to convince them.
Yes, and look, we want to acknowledge from the forum, Fiona, that you've always been a available and hard-working representative of your constituency and the people of Victoria more generally in socially progressive and humane policy settings, and it is very much appreciated by the Yarra Drug and Health Forum. We appreciate you making yourself available. We look forward to as many people coming to the event on Monday night at Embra Gardens, 6 to 8 o'clock, or tuning in online, because we will simulcasting the event as well. And so on behalf of the forum and on behalf of Harm Reduction Victoria, we thank you for your time today. And like you say, Fiona, I don't think anyone is opposed to keeping people out of prisons for reasons that shouldn't have them in jail. And we see this as a marathon and not a sprint. But all strength to you and to your work in Parliament, Fiona. Thank you.
Thank you, Peter. Thanks, Nick. I look forward to seeing everyone on Monday evening.
Cheers.